Welcome back. Dr. Stewart Eidelson is a fellowship-trained spine surgeon with Delray Medical Center who's published several books on spine surgeries and performed over 4,000 cases. He's here to talk about your bad back and how you can fix it. Dr. Eidelson, thank you so much for coming on the show.
Thank you.
How are you?
Good.
All right, so in South Florida, people are active every day. Golf, tennis, yoga, jogging, whatever. And with that comes a lot of back pain, right?
Correct.
So I would imagine there's people watching all over South Florida whose backs are bugging them right now. So let's kind of start with that broad sort of generalization.
Yeah, back pain is pervasive in South Florida because people, whether they're elderly, coming down to play golf every day or playing tennis, or whatever they want to do, back pain, we see it in the professional athletes, is a big issue. The good news for athletes today is that we have lots of good treatments. Fortunately, most of them are not surgical. Even though I'm a spine surgeon, our first goal is always non-surgical treatment. What does that mean? One, it can be as simple as medication. Two, physical therapy, even chiropractic care. But the people that I tend to see have tried many of these things, have not worked. So they get a little more specific. They'll come to my office, we'll do a physical examination, we'll explain their condition. A diagnosis is key. People must have a diagnosis. And we may do an MRI or x-rays, and then we have a plan of treatment. Many of the patients I see, besides physical therapy and medication, we'll give them an injection, which doesn't hurt. We freeze the spine. It's called pain management, and we do a small injection of Novocaine or steroids around the inflamed area. So if there's a little mild of the spine, a lot of people think everything in the spine is the disc. The disc is a little jelly-filled cushion between the vertebrae. But what people don't realize, in the back of the spine, there are hinges, just like an elbow or a knee joint. Those hinges are what cause people to walk in my office bent over, playing tennis. They get inflamed. Many times, assuming the simple remedies don't work, under fluoroscopy, do a simple injection, and they do great. And they'll do some stretching. We use Pilates. We have a whole team in my office, and that works out. The small subset of patients, which is about 5% over time, these things may not work. And we do an MRI, and either there's a herniated disc or an elderly patient, the little windows can be closed. We call that spinal stenosis, very big in South Florida, and we have great treatments. What we do is we go in there and do the injections. If that doesn't work, we may take them to an outpatient procedure. We now have the technology to do many things on an outpatient basis. The recovery is rapid. Many of my patients are back playing golf in 4 weeks. The most recent advance in South Florida is robotic spine surgery. And I've been lucky enough with Tenet Health System to invest in a very expensive technology, the MAZOR robot. And with the MAZOR robot, and you can see this all on the website, Ortho-Spine, we now have the ability, like a GPS in your car, with image-guided and guidance system to place small guide pins and do much less invasive surgery, much quicker recovery, much more predictable.
So this technology we're talking about, this robotic surgery, I know that you said that they're not doing it everywhere at all the hospitals around the country. How prevalent is it?
Well, it's a very expensive technology, and you have to have a health system that's willing to invest in technology and be at the cutting edge. Fortunately for me, at Delray Hospital in Delray Beach, Florida, we have that technology, and there are many surgeons learning to use it. I have had a good experience now. I've done a number of cases. We're publishing those results, and the results are spectacular. Most importantly, the predictability. People are always nervous. Spine surgery, they're going to take months of recovery. They're going to have complications. But with that system, in guidance with a good physician who's had, in my particular practice, this is all I do, spinal surgery, I think that the success rate is high. The complication and failure rate are very low now. And people should be, it's kind of a renaissance in the treatment of a spinal condition.
So some people who need surgery, is it because maybe they just wait too long to come see you in the first place? In other words, they tweak their back and they don't do anything about it, and we're guys, so we don't like to stretch, and next thing you know, you got real problems.
Well, the biggest problem in spine I see in South Florida is that everybody's treating, it's so pervasive. You have chiropractors, acupuncturists, you have the pharmacists, everyone's getting advice from their next door neighbor. And the patients, not like other areas of medicine, don't go to a real specialist and get a true diagnosis, a true physical exam, and a plan of treatment. I think they're a little fearful to go to spine surgeon because they think we operate on everyone. But in reality, I only operate on 5%. And I think that's the key thing I see in South Florida. Getting a proper diagnosis is key. So you have to examine the patient, and you don't have just one thing that you do on everyone. We do what we think a combination of non-surgical treatment. And I tried to bring a team together. And with that approach, surgery is seldom necessary. Most of the time, this team approach really works out nicely. And my goal is functional recovery, getting people back to do the things they want, whether it's their job, their sports, even sex is a problem with women and people with back pain. These are personal issues for some people, and we try to work with that. We try to keep people off these narcotics. There's a lot in the news about these pill mills in South Florida. We don't find it necessary at all to use narcotics, even after surgery. Very seldom that I have to give strong pain medication because our incisions are very small. This guidance system using the MAZOR robot allows us much smaller incisions, much quicker recovery. Patients walk out of the hospital.
So if in your opinion, your diagnosis someone needs that surgery, is there anyone that would not be a fit for it based on pre-existing conditions or anything like that?
Well, the MAZOR robotic is really when we're putting hardware in the spine. A lot of advanced conditions where the bones have actually slipped out of position, more severe issues, we have to put some type of hardware, meaning screws, rods. That's what that system's for, the placement of hardware. If I'm doing a simple discectomy, a microdiscectomy with a microscope, it's a small incision, it's 45 minutes. I don't need to use robotic surgery. This is for the really more complex. Unfortunately, though, a lot of the senior patients I see, they have very complex spinal problems, or a lot of the athletes where the bone has shifted out of position, I have to realign it. I need to put these hardware titanium devices in, and you want to do it in a very predictable, reproducible, and precise and safe way. That's what the MAZOR robotics system allows me to do.
So let's kind of end by going back to the beginning. What advice do you have for anyone out there who's an athlete in terms of how to start taking care of their back so maybe they ultimately won't need surgery?
Well, the classical things, you know, preparation. Most people, stretching exercises, being fit. I have people that come to me up north, they come down and get off the plane and play 36 holes of golf and they're completely out of shape. Or the guy that's doing some sport that he's done once a year, plays rugby. So you have to condition, we have to do stretching. Most people try to work out in a gym. If things do hurt, you need to just not, you gotta have a plan. I don't want the patient coming in, I took 25 Advil. You have to kind of slow it down and have a recovery plan. And ultimately, if they're really hurting, most things get better on their own. If it's just a strain, you slow it down, take some ice for severe pain, heat, some over-the-counter medication. If that doesn't work, you should see a specialist and get good advice.
Okay, so if they want to see the specialist and they want to see you, how do they get a hold of you?
They can, my name is Dr. Stewart Eidelson. There's a website, ortho-spine, ORTHO-spine. Or if they just Google my name, it will get you to that location.
Well, thank you so much for coming in, and at the risk of ending with a bad pun, let's have you back sometime soon.
I would love to be back.
All right,
Thank
take care. All right.
Thank
Thank
you.
you, Dr. Eidelson. When we come back, from Jay-Z and Justin Timberlake to Dolphins preseason games and food festivals, there's a lot of great stuff going on across South Florida this month, and we got you covered. Stick around.